Ventricular fibrillation and atrial fibrillation. Which is more serious? Ventricular fibrillation versus atrial fibrillation. The left and right atria form the upper chambers of the heart, and the left and right ventricles form the two lower chambers. Together, all four chambers pump blood to and from the body. When the atria, the two upper chambers, contract at an excessively high rate and in an irregular way, the patient has atrial fibrillation or AFib. When the two lower chambers beat irregularly and flutter, the patient has ventricular fibrillation or VFib. Both produce an irregular heart rhythm. Ventricular fibrillation is due to defective electrical impulses. It causes the ventricles to quiver uselessly, pumping virtually no blood into the body. The heart ends up without an effective heartbeat. Blood stops flowing around the body, and vital organs, including the brain, lose their blood supply. A patient with ventricular fibrillation will typically lose consciousness very quickly and will require immediate emergency medical assistance, including cardiopulmonary resuscitation or CPR. If CPR is delivered until the heart can be shocked back into a normal rhythm with a defibrillator, the patient's chances of survival are better. Ventricular fibrillation and atrial fibrillation. Which is more serious? Ventricular fibrillation is more serious than atrial fibrillation. Ventricular fibrillation frequently results in loss of consciousness and death because ventricular arrhythmias are more likely to interrupt the pumping of blood or undermine the heart's ability to supply the body with oxygen-rich blood. Ventricular fibrillation can cause sudden cardiac death or SCD. Sudden cardiac death accounts for about 3 lakh deaths annually in the United States. Sudden cardiac death can kill a victim in minutes, and it can occur even in people who seem healthy.